Diabetes truly is an epidemic in the United States and really in the world. We are approaching almost 1 in 10 individuals having a diagnosis of diabetes. And so with that, it's really important that you understand what diabetes is, what can happen with your foot and the rest of your body, and why it's important to have a specialized treatment team to treat all of these aspects. According to the American Diabetes Association, every individual with diabetes should have a comprehensive diabetic foot exam at least once a year. At this foot exam, you will be risk stratified to determine how often you really should be seen based on your risk for complications with your diabetes. Things that we will be looking for at this comprehensive diabetic foot exam will be 1, looking at your skin. Are there any pigmented lesions, sores, areas of concern such as callousing or pressure? 2nd, we will look at your vascular status. Do you have palpable pulses? Just like you have a pulse in your neck or your wrist, you're supposed to have 2 pulses that are easily palpable on your feet. Next, we will look at your sensation in your foot to determine if you can feel light touch or not. There's something called peripheral neuropathy, which can develop with diabetes. What that is you will lose light touch sensation or protective sensation. We use a simple device, which is a small monofilament, to touch your skin ever so lightly to determine if you can feel it with your eyes closed. This will give us a really good indication of if you have peripheral neuropathy or not. Lastly, we will look at your generalized foot structure. Do you have any deformities? Bunions, hammer toes, very high arches, anything that will put you at an increased chance of developing pressure points that can lead to ulcerations or sores. The most common complications that we see associated with diabetes and the foot are ulcerations or sores on the foot. The most common reason these will develop is if an individual has lack of sensation in their foot or peripheral neuropathy, and they're rubbing enough that their skin breaks down. Most times, diabetic individuals don't know that they have a sore on the bottom of their foot because it doesn't hurt like it should. That's why protective sensation is so important. So if you notice you have any sort of sore or opening on the bottom of your foot, redness or drainage, it is imperative you seek treatment right away. The morbidity and mortality associated with diabetic foot ulcerations are very well studied and unfortunately not so great. So when we look at ulcerations, we know that the overall incidence of diabetic foot ulcerations in the diabetic population is almost 30% or 1/3 of people. And if you heal a diabetic ulceration, we know that the reoccurrence rate in the first year alone is 40%. So even if you heal an ulceration, you're at an extremely high risk of developing another one. Lastly, we know, unfortunately, that the mortality rate within 5 years of having a diabetic foot ulceration is actually 50%. For these reasons, it's important that you are associated with a well-educated podiatrist in diabetic foot care and ulceration care. If you have a diabetic foot ulceration, the most important thing you can do for yourself is seek treatment. So when you come into the office, what we're going to do is comprehensively look at your foot and determine what's going on and what the cause of the ulceration is. Not all ulcerations are created equal. Some can be infected, some not infected. Depends on the depth of the wound. Is there soft tissue involved, or is there underlying bony involvement as well? What we will do when you come in is take a look at the wound, clean the wound off. Sometimes we have to use sharp instruments like a scalpel or curette to clean off any non-viable tissue to really be able to take a good look at the wound. We'll do serial measurements of the wound to make sure we know exactly if the wound is getting smaller or not. We may also take x-rays of your feet to determine if there's any underlying bony involvement. Sometimes we have to send you for lab work to make sure that there's no sign of infection, or vascular testing to see if your blood flow is contributing to the reason you have an ulceration. Once we've thoroughly examined your diabetic ulceration, reviewed your blood work, your x-rays, your vascular testing, we will be able to come up with a comprehensive, individualized plan for your foot ulceration to make sure we can treat it in the most efficient way possible.